Busulfan and Melphalan, so this was a phase 3 trial that we conducted here at MD Anderson Cancer Center, and the results were published by my colleagues and myself in Lancet Hematology in 2019. So we used Busulfan plus Melphalan conditioning based on some preclinical data as well as some phase 2 data from the Spanish myeloma group, which showed a longer progression-free survival, although they were using oral busulfan before the general availability of IV busulfan. So there was higher treatment-related mortality, and they had to stop that study. But we use IV busulfan, we do pharmacokinetic monitoring, and we adjust the dose. And because of that, this use of busulfan has become much safer, and it's part of most of our conditioning regimen. So in this trial, we treated more than 200 patients. About 100 of them were in the Melphalan arm, and the other, and 100 plus in the busulfan Melphalan arm. And what we reported was that our median progression-free survival in the busulfan plus Melphalan arm was almost 20 months longer. Again, those numbers can change with longer follow-up, and that was consistent across all subgroups, and especially in patients who had high-risk chromosomal abnormalities. In terms of toxicity, of course, when we are using two alkylators, there is bound to be more toxicity, but most of those were grade 1 to 2 events, and patients had more mucositis in the busulfan plus Melphalan arm. They had transaminase elevations, and they had more neutropenic fever. But the treatment-related mortality in both arms was 0, and all the toxicities were reversible. And in terms of second primary malignancies, when we last evaluated that, there was no significant difference between the two arms. And of course, in terms of induction or maintenance, there was no difference between the two arms. So based on that, we are using busulfan plus Melphalan, especially in our high-risk patients, because we would like to have a longer follow-up and perhaps see some signal in terms of overall survival. But based on progression-free survival, which is longer in high-risk younger patients, we are using that in that group of patients.